Hello students. Last pharmacology class was held on the topic analgesic and their several classification and briefly discussion about opioid analgesic. Now today's topic is NSAIDs or non-steroidal anti-inflammatory drugs. So what is inflammation? Inflammation is the immediate response of our body in response of harmful stimuli. The treatment of patient with inflammation involves two primary goals: relief of symptoms and the manifestation of functions like the major continuing complaints of the patient. And the second goal is slowing or arrest of the tissue damaging process. The reduction of inflammation with NSAIDs often result in brief of pain significant periods. Now, NSAIDs are used alone or in combination process. They provide symptomatic relief but should not taken on a long-term basis. Example: paracetamol, aspirin, ibuprofen, naproxen, diclofenac, mefenamic acids, etc. Now, according to their function, we have some following groups of drugs according to analgesic or relief from pain, antipyretic means relief from body temperature increase process called as fever, and inflammatory process, relief from inflammatory process. We have just learned about what is the medication use in this process. So now what is the mechanism of action of NSAIDs in this um, function, means in this type of effects, like as inflammation or as anti-inflammatory effects due to the inhibition of the enzymes that produce prostaglandin H synthase, cyclooxygenase or COX, which converts arachidonic acid to prostaglandin and to TXA2 or tranexamic acid and prostacyclin process. Now, what is this TXA? It is a medication used to prevent excessive blood loss um, from major trauma. Now, aspirin irreversibly inactive COX-1 and COX-2 by acetylation of specific serine residue. This distinguishes it from the other NSAIDs which reversibly inhibit COX-1 and COX-2. Now, according to analgesic process, the NSAID's effect uh, is thought to be related to the peripheral inhibition of prostaglandin production. It also may be due to the inhibition of pain stimuli at a subcortical site. And the other process is NSAIDs prevent the potentiating action of the prostaglandin on the endogenous mediators of peripheral nerve stimuli. Example, bradykinin. Now, the another function of NSAIDs on antipyretic effects. The antipyretic effect of NSAIDs is believed to be related to inhibition of production of prostaglandins induced by interleukin 1 and interleukin 6 in the hypothalamus. So what is interleukin? This is a group of naturally occurring proteins that mediate communication between cells. Generally, it regulates cell growth, differentiation, and motility. Uh, Now, the second process in antipyretic is the resetting of the thermoregulatory system, leading to vasodilation and increased heat loss. Now, this slide is contained with the chemical classification of NSAIDs. Chemically, NSAIDs are broadly classified into four groups. We can see non-selective COX inhibitors, mm, which are basically traditional NSAIDs. In this group, there are total 8 subtypes are, you can see, they are enlisted. Aspirin, ibuprofen, diclofenac, these all are the non-selective COX inhibitor types NSAIDs. Next is preferential COX-2 inhibitors. Some examples of drugs are here, you can see. Next, selective COX-2 inhibitors and analgesic antipyretic with poor anti-inflammatory actions. NSAIDs are generally we know the paracetamol, which have the analgesic effect, the antipyretic effect, and also a poor but have some anti-inflammatory effects also there. So, what is the NSAIDs and prostaglandin synthesis inhibition process? NSAIDs blocked prostaglandin generation. Prostaglandin or prostacyclin and thromboxane A2 are produced from arachidonic acid by the enzyme cyclooxygenase. Now, cyclooxygenase exist in COX-1 and COX-2 two isoforms. Recently, uh, scientists also has been identified COX-3. So what is cyclooxygenase? It is found bound to endoplasmic reticulum. Um, Generally, the COX-1, COX-2, both enzyme produce prostaglandin. We just know that promote the inflammation, pain, fever. So indirectly, COX inhibition process, however, is related with the function or the mechanism process with of NSAIDs. Okay.